Good morning and welcome to Essential Ingredients. I'm your host, Justine Reichman. With me today is Andy Bennett. He is the executive chef at Lenox Hill Hospital in New York City. Welcome, Andy.
Hey, how you doing today?
I'm well, thank you. And you?
Great.
Great. Well, I'm super excited to have you here. Your background is just so vast and varied, and you've worked with other amazing chefs. And you've taken a little bit of a change. You've made a change to go from one area in food to another area of food. And I'm not sure the people at Lenox Hill know how lucky they are. Because hospital food is notoriously not amazing.
Yeah, and so I think there's a good couple of parts to that, and because people ask that question, how did I make this kind of turn or kind of jump in this direction? And it really came from, I've been extremely lucky to work with some phenomenal chefs and done a lot of cool things. But there was a restaurant late 2008 we opened called Rouge Tomate.
I
And
love that place. Wait a second, you mean right around the corner? It was like right by a block or so from Barney's and
yep.
around the corner, and now it's Avra.
Yes,
Yes.
exactly.
I loved Rouge Tomate.
Yep.
Oh,
So, and the whole premise there, and 2008, so there was a challenge in there, and that I think the industry was very different in what everyone was expecting, and the whole goal was to show, okay, you can do fine dining food, but it can be healthy, right? And break down some of the stigmas around what that is, and on a very basic premise, no butter, no heavy cream in the savory dishes. We worked with a team of registered dietitians, and while we were doing this, it was great learning experience, and all these kind of things that you kind of reset your mindset about being creative as a chef, and instead of thinking, okay, we can't use these ingredients, it's a restriction. You use that as I just need to be more creative. Like, how do we find a solution to this? But while we were doing that, I was thinking, okay, there's other things I want to continue to do in my career, other areas I want to kind of develop and grow in. But and Rouge Tomate was amazing. But again, we're cooking for a very small percentage of people making healthy food. Great. But can I take all these things I've learned through craft, operations, leadership, and then do something good with it? Like, how can we help more people? And healthcare was that kind of logical step to be able to combine those two. So I kind of got to a point in the career, I was like, hey, I'm ready to do something different. I looked at, I just started researching healthcare groups and hospitals and all these kind of things. And, I came across Northwell, and there was already a ton of great press about what Northwell had been doing on their food program, really starting about 8 years ago, in terms of making that first step of realizing, okay, we need to put the same energy into our food and hospitality as we do in all our clinical care. And then that huge process, across a big network, how do you move that forward? Looking at kind of all those details.
so I'm curious, and I don't know that this is a question you could answer. It might be out of your scope. But, I think food is integral to people's health and how we live and how we feel and how we recover. And oftentimes people are in the hospital, whatever the issue is, needing to get better and recover and feel well. And with the food in many hospitals, I'd say that, a lot of times what I hear from people like my mother or whomever who've been in the hospital are like, you need to send me food, DoorDash
Yep.
me something, caviar me something. This is just awful. And you look at it and you're like, you feel bad, right? So I wonder by Northwell and you collaborating and working with Lenox Hill and whoever else to provide better for you food options, how that impacts, or if we've seen any numbers on how it's impacted people's health and recovery.
100%. And there's a lot of things that go into that in terms of working with, we have a full team of registered dietitians. There's a lot of programming that kind of goes in terms of recipes, nutritional analysis, how we break that down, how we work on these dishes. But that very first step, kind of like you're talking about, is how do we get people to want to eat, in a situation where they might not be hungry, not in a great place, not super happy. So we take it all the way back to the beginning. We write menus that look like if I handed you Lenox Hill's menu, you would have thought it's a restaurant menu. So on beautiful paper, beautiful designs, and it will read exactly the same way. It won't read like you're in a hospital. So we have this kind of first part where we say, how do we create this, environment and this kind of situation for the patients where at least also mentally we get to take them away from their problems for a little bit, give these kind of 10, 15-minute windows of not have to worry about something. And then we basically go from there. We build those menus, making sure we hit lots of bases, whether that's making sure we have lots of plant-forward dishes, lots of clean proteins, tons of vegetables, and then making sure we can, in a hospital like Lenox, which is a tertiary hospital, we run we have a lot of patient needs in terms of dietary, and a lot of things we need to kind of hit, and a lot of people we need to make happy.
That was my next question, because people come in with, nowadays, right, versus 40 years ago, people are much more acutely aware of some of their own issues, whether it's gluten intolerance or allergies or IBS or fructose intolerance. So how flexible are you to be able to tailor those menus to meet the individual patient needs? Because you have so many people in there. That can't be very easy to do.
It's, there's a lot that goes on in the background. So a lot of the software we use for putting orders in, dietitians will do that programming. So, as chefs, we make our recipes, we run nutritional analysis on it. Okay, we fit it into the guidelines that we need, whether it's for certain diets or for, just across the board. That gets programmed in. And then when a host goes to take patient's order, the patient's diet or any restrictions are already programmed in there. So anything they want to eat or anything they can eat is going to be available. Anything they can't eat that won't hit their guidelines is going to be blocked out.
Wow, that sounds like a tall order, though, for the people in the kitchen.
Once it gets to the kitchen, all the hard work is in the preparation and the programming and the development. Once it gets to the kitchen phase, it's no different from a restaurant kitchen in that sense. And coming from restaurants, it's almost exactly the same thing. You have, whether it's restrictions or requests, the same kind of thing applies.
That's amazing. I think that in this day and age, I don't know how many hospitals offer that.
Yep. Yeah, and I think, again, I think where that culture shift comes from is why does it have to be different from a restaurant or hotel? Why can't it be exactly the same?
Right.
And I think by bringing, chefs from outside in, and then just having that mentality, okay, where do we find, and again, to go back to your original point, like our goal is to make sure that people don't want to order food from the outside. We want them to have our food because it's going to help with the healing process. We know it's great, clean food. And then there's a knock-on part of this is that part of what we hope in some of these situations is that it's also education. People could be in the hospital because some of their food choices historically. So if we can show that, they get this food, they realize like, this is great tasting food and it's healthy. It fits what I need in my life right now. So we have this kind of training, teaching moment as well with patients in terms of, okay, right, the goal is for them not to come back. The big difference from, the hospital and the restaurant is that we don't want to see them again at this point.
Like when they leave the hospital, now what? Now they've had this. Does that nutritionist have, or the nutritionist is on staff that work with the food, are they the same ones that work with the patients to create their meal plans when they go home or to give them guidance?
Exactly. So that will work all the way through. And we have, dietitians that are working in particular units or assigned certain units. And that kind of works the way through, whether it's, things that we can give them to take away, whether it's, simple recipes or just kind of guidance of where they should be going, along with, and again, I think it's right. We want to, and this is in general, I think in food, right? The hardest part, I think, of getting people to eat healthy is understand, like, how do we find these kind of gateway dishes, and they need to be recognizable, right? And
Hmm.
that's the first point. When we can get something that's recognizable, that is healthy, and it's like, oh, I like this, then it starts to build. Then we get excited about vegetables and all these other kind of clean ingredients.
My question, as I'm sitting here listening to you, and I'm wondering, okay, if I was in the hospital, I'm eating this food, I'm feeling better, is there a way to, do you guys have a service that would deliver it to me made? Like, is that coming next, or do you have that? Because it
No,
just seems like that would be an easy way to maintain people that are just recovering, still at home, maybe can't do everything themselves just yet. It's like a bridge the gap.
yeah, and I think it's twofold. I think one, like I say, that kind of the extra education as we go out in terms of recipes and ongoing training, and this kind of idea, if we can create these programs through videos, I think is one step. And then you also have to look, there's um, how far can the kind of looking at food as medicine and it being a medical expense that can be paid for by insurance companies, and looking at those avenues, which that's a long way off, I think. But I mean, there's programs already in place, I think, within healthcare that's starting to go that direction. But I think if we can look at, I think jump around a little bit, but I think the other side, why I think Northwell can be super inspiring is that, from Northwell's look on it, that same kind of thing. We don't want patients back. So how do we invest more in prevention opposed to on the back end?
Right. And preventative medicine has always been a little bit challenging, right? Like, what are they going to pay for preventative? There's certain things, annual checkups, certain things like that. But getting something like this is, while it's been more popular and more of a conversation in the last 10, 15 years, it's still, on the fringe, right? And
Yep.
it's still not integrated. So I don't know if Northwell has thought about sort of the next step of creating policy change, if that's anywhere in their agenda, because that to me, I mean, I don't know what motivated Northwell to do this. Maybe you can share that. But it seems like it would be, you can't tackle everything, but it does sound like it would be something they'd be interested in.
Yeah, 100%. I think that's, when we look at where we came from on the food journey and, kind of 8 years ago to where we're at now. And I think the exciting part with Northwell is like, hey, we're doing great and we've done a lot of great things. And I think other healthcare systems are looking at us and saying, okay, how did you go about this? Because everyone thought it wasn't possible.
Right.
Um, so, that impact healthcare system wide, across the country, that impact that Northwell's had is already huge. But for us internally, we're still not happy with where we're at. We still find, okay, each bit, once we hit that little milestone, whether it's in scores or when it's just, something we've looked at, we then look at the next thing. Where do we find the next kind of bit that we can improve and just kind of keep going from there? So
Talk to me about their landscape and how far and wide it goes.
Northwell is the biggest healthcare provider in around New York. We're about to hit this year, as we get about halfway through this year, we're about to hit 100,000 employees across the system.
Wow. Okay.
So largely in Long Island, in Manhattan, Staten Island, and then this year, with some acquisitions, moving into Connecticut and kind of into the Hudson Valley a little bit.
And are
So
you in
it's
all the boroughs?
mainly Queens, basically Queens into Long Island, Staten Island, and Manhattan.
So I mean, I think this is amazing, and I love the way Northwell is going to do this. Do they see themselves, and I don't know if you can speak to this, expanding outside the Northeast Corridor? And Northeast Corridor really goes from, Philadelphia to Boston or something, right? But can we see them expanding to the West Coast, or is it?
Not something I could fully answer. My assumption would be no, just because of we're at that point where we're big at this point, so how we kind of navigate through that, and how much, and how quickly we grow. Yeah, that's definitely a question for someone else.
I'm just curious because
Yeah.
it does seem like you're a leader in this space, unless, of course, you know of other organizations that have such a strong focus on this, but I'm not familiar with them.
No, and I think, I think the great thing is, I think there's lots of healthcare systems are starting to take it seriously. which is just a win for everyone. And I think it continues to push us in that sense because, as we go through, it's like, okay, as that bar gets raised across the platform, okay, we have to continue doing more and continue to find those ways. So I think we're still at that kind of exciting phase of that kind of progression. And there's also, I think these things that Northwell do, and I think one of the big things we do, we have a chef challenge every year. And, across all the hospitals, basically what happened, Bruno will kind of pick 3 ingredients, one for the appetizer, one for the entree, one for the dessert. The chefs get a good couple of months to conceptualize, and then we do a big kind of, basically all the employees across the network get to vote which ones go to the final. Then we have a big kind of, cooking competition. And a lot goes into it, and it's great. And, chefs are competitive, and, lots and lots of fun. Really, because one of the big parts of that is that part of the rules of that are any of the dishes that we do for the competition have to be on our menus in the hospitals. It can't just be things that aren't attainable. It has to be something that patients are going to get. And ultimately what that does is just continues to push all the chefs forward to be creative, raise kind of the level of the food. So internally we have lots of things like that I think, that help us continue to kind of drive forward.
So I know that you've been working there now for how long?
A year.
A year, okay.
Yeah.
And so I'm sure, there's a lot that goes into this, but I'm wondering, as, somebody that works in this program and is the director of it, if other people wanted to do this on the West Coast or, in the Pacific Northwest and be able to offer something like you guys are doing, where would you tell them to start? Like, where's the top 3 places you'd say you need to just start?
I think I think it's funny if there ends up being some very kind of basic things, and again, like we go back to that, start with the quality ingredients, I mean, you need to bring the talent in, right? You need people that are going to understand and be able to kind of work in that way. Like that's what you're looking for, scratch cooking, everything made in-house. And one of the reasons why some of that hospital food has such bad reputation is it was a lot of pre-made food, right? Open in bags, freezer bags, reheat, not really any real cooking going on. So you have to reset the kitchen and retool the kitchens to fit what you want to do, so at Northwell, what was done in the beginning was there was a lot of conversions where there was lots and lots of big walk-in freezers. They got converted into refrigerators so we could have fresh produce, fresh ingredients, and then new ovens, stoves that we could actually cook like we would do in a restaurant. So you're applying all these same things as if you were going to open a restaurant. You got to look at it in that same, or if you're going to open a hotel, it's got to be that same mindset. Yep, maybe the way you do service is a little different, but you're looking at those same things. Quality ingredients, make sure you've got the tools to do the job, make sure you've got the talent that can produce this and execute. But that's where it's going to start. It's going to be that ground level. And I think the biggest thing, I go back to what I said earlier, is that there has to be a true belief in that this is what we're doing. It's not something we can go in half, okay, we're going to improve our food. There's got to be a drive to say, our patients deserve better, and we're going to go after that, and we're going to make that happen.
You have all these frozen produce in your refrigerator. Now you're getting fresh. I was curious about the incremental cost, but also any additional waste.
Yeah, and I think and again, this was kind of, these things phased in before my time, but I think what happened was that it was actually the opposite. It was less waste because people were eating the food.
Okay.
So instead of having all this food that we kind of need to heat and send, and then people are just like, okay, this is not what I want. And then, and then the other part of that, I think, is when you go to that kind of system, it's just like you would in a hotel or a restaurant. You can look at your numbers in terms of, okay, what you sell, what your big sellers are. And then again, it's just, kitchen management and, how you kind of work those things and go through that. But I think the opposite happened of what we thought, because other people have said the same thing. You're assuming it's going to be the other way around.
Right.
And it's, we found the other way.
Wow, this is so interesting. And so, I mean, it's personal for me also, as I, have an elderly mother who is potentially actually putting into a long-term nursing facility because she has ALS. And I'm like, oh my God, she's never going to eat
Yep.
because the food is not going to be good. So, I'm sitting here going, okay, well, how do we make this happen in Florida?
Yep.
Right? How do we inspire people to recognize the importance of food as part of taking care of these people?
Yep.
What do you think the biggest challenge is in that?
Right. I think if you're buying food that's already pre-made and all you've got to do is reheat it, it's easy, right? There's a lower risk there, right? So I think that the biggest hurdle was getting companies and people to be brave, have the courage to say, okay, no, this is what's right, and we're going to do the hard thing. Like, yes, the hard thing, it's scary in the beginning because all of a sudden you're applying new variables. We've got fresh food. We need a team of chefs to kind of come in and operate at a higher level. Can we, and in a hospital setting, right? You're also looking at feeding a lot of people in a very short space of time, 3 days a week. There's no, in the restaurant industry, right? You'd have your ups and downs, your lows. For
Right.
hospitals, our business level is extremely consistent. So you're adding these variables that I think can be scary from an operations standpoint. But I think ultimately you just got to say, okay, this is what we believe in. This is the right thing to do. And I think the other thing that I think would help maybe change decision makers' way of looking at it is get them to go eat the food. So, and if they're okay,
Actually, it's smart because you know what? The minute you said that, I was like, never. I
right?
don't want to go eat that. That's awful. I've seen it.
Yeah. So if you're running a company and it's like if you wouldn't eat the food, okay, you've got a problem. It's got to be something, right? We very basic tenet, right? As a chef, you're like, hey, would I be happy with this? Like, it's a very simple question to ask. And if you wouldn't be, then okay, you're doing something wrong, and that needs to change. We have a funny thing that for us that created a small problem in that the food across Northwell has improved so much that we actually have trouble getting people out of the beds. When it's their day to discharge, we need the beds back and everything. But what we've found is that we have people that want to stay. Oh, I'm just going to stay for lunch. I'll go after lunch because they want to stay for one more meal. So a great problem to have, and again, if you step back from the whole thing, right, we talk about it in terms of this is just the right thing to do. People deserve good, healthy food, especially in a hospital when we're talking about starting the healing process. But when you step back from that, it's also a business advantage. We have a lot of people that, come back to us, whether it's for pregnancies or just the hospital, because they know if they're going to make a choice, especially, in Manhattan or in New York, people have a massive choice of great healthcare systems that they can go to.
Yeah.
So knowing that you can go to Lenox Hill and get great food, and that help them make that choice, it's, from the bigger picture, it's also a business advantage. So
Well, I mean, you have great doctors there to begin with. So and it's known for, women giving birth. I mean, it's known for a lot of things, right?
Yep.
But equally, I mean, to know that, oh, hey, look, I could choose one of the top doctors and I can have great food,
Yep.
which I think that makes you just feel good. You don't feel like, ugh, I'm going to be in the hospital stuck with mush and broccoli that doesn't look like broccoli. It's like brown and meatloaf that, ugh.
And we have, I think what's one of the things we do across the network is that chefs will go around on patients the same way we would in a restaurant visiting guests. So also a big part of our day is that interaction with patients. It helps us kind of learn what's going right, what's going wrong. But we get in these situations where, either I can't leave the room because we get stuck in a conversation about food and all this, or, we get people asking for the recipes of the food they ate because they want to make the same things at home, right? So unheard of. It's a crazy situation that we're
crazy situation. And I think it's really inspiring as I'm sitting here. I'm like, they need to do this in nursing homes. They need to do this in hospitals here. I mean, it seems like it should be on everybody's mind. And as we talk about the impact of food on our health and wellness, I really hope that people listen to this and really hear what you're saying and the impact you're having. so that maybe we can experience this in all parts of the world.
Yep, absolutely.
So are there any analytics, though, in particular that you know of based on changing the food and people's health and well-being that you could share?
I mean, one of, not necessarily directly related to one of our, there's a rating system that we use within the hospitals, and where the system is Press Ganey. When you leave the hospital, you get a questionnaire sent to you emailed, and it covers everything in the hospital.
Right.
How you were checked in, cleanliness, everything all the way through. When Northwell started the journey, and I forget exactly where about, but you're as a percentile of everyone that uses Press Ganey in the United States. And Northwell was, if I remember rightly, somewhere in the 40s. We're now, I think we're at about 86.
Wow.
As a system. So that's that journey of kind of where we've come from, and we're
Evolved.
still, we still believe we've got, and we have a lot of hospitals within the system that are in the 90s. So that journey, that metric's the one we look at, I think, the most in that sense. Lots of other intangibles that go with that, but I think that represents what we are doing, and where we've come from, because it's a very, for better or worse, it's a black and white number we're looking at.
Andy, thank you so much for joining us today. I learned so much. I hope that our guests did too. And I hope that it inspires some change around the world for other people in the healthcare system. I know if I'm going to be in New York, or when I'm in New York, I would now put that on my radar when I'm thinking about if I needed to be in a hospital. Care and food, they go hand in hand. So,
yep. There you go.
So again, I appreciate it so much, and we look forward to continuing to follow the journey and see what Northwell does as time goes on, what new things they integrate. So thanks so much for joining. For those of you tuning in today, thank you so much. If you're listening to the podcast, don't forget we do have a video cast on YouTube, where you can go to at Essential Ingredients or at nextgen.purpose. If you're watching the video and you haven't done the podcast, feel free to go to Spotify or wherever you listen to your podcast and listen to Essential Ingredients. We're also on Instagram at Essential Ingredients. Like, subscribe, follow, and we look forward to hearing from you guys as to what else you want to hear from us.